Excessive sweating can be humiliating and embarrassing. It's a condition that is known to lower self-confidence and spoil personal and social relationships. Mild cases of excessive sweating can be easily treated just by avoiding certain foods or drinks or by applying topical antiperspirants on the affected area. However, there are cases that are so severe that patients look to invasive treatments like surgery for help. Admittedly, surgery is currently the only way to permanently solve hyperhidrosis. But before you sign up for a procedure, you should be warned that procedures carry certain risks. One such surgical option to hyperhidrosis is called endoscopic thoracic sympathectomy, or ETS, or simply sympathectomy. Anatomically, sweating is controlled by the sympathetic nerve cells, which are part of the network of nerves that work unconsciously in response to the needs of our body. In cases of excessive sweating, many believe that it's the overactivity of these nerve cells that cause the overproduction of sweat. So theoretically, if these nerve cells are cut off from the sweat glands, then there's no way to stimulate the sweat glands to perspire. In sympathectomy, this is what the surgeon aims for. He looks for the specific bundle of nerves that are responsible for sweating, then cuts them. This surgery is often performed to address underarm and palmar sweating. During surgery, the surgeon inserts an endoscope, which is a microscopic camera-like device, into an incision made between the ribs, located below the armpits. With this camera, the surgeon is able to look inside the body and locate the target nerves. Once they've been identified, the surgeon then cuts the nerves. This permanently prevents sweating in the areas controlled by those nerve cells. Sympathectomy as a treatment for excessive sweating is risky because aside from puncturing the skin between the ribs, the lungs will have to be dilated during the whole procedure. This puts the lungs at risk for damage. There are also cases when nerve cells that control other functions end up being affected by the surgery as well. A common side effect for people who've undergone sympathectomies is a condition called compensatory sweating. What happens is the sweat that you lose in the areas where surgery is performed is transferred to other areas of the body. For example, after surgery, you no longer sweat in your armpits, but now your feet sweat twice as much, or you begin to sweat on your thighs. Some people say compensatory sweating is just as bad as the original sweating condition. Although the rate of success for sympathectomy is high, you should know that surgery is never a must. You should be especially aware of all the risks and the side effects involved. And when you do decide to push through with surgery, finding a qualified and experienced surgeon to perform it is very important. When dealing with excessive sweating, it's all about finding the right routine and treatment that works for you. To find the right cure for your problem, download a free report at stopsweatingmagic.com/free-report.html. Learn if excessive sweating points to an underlying medical condition. Learn what you should do and what treatments are available. Download your free report and magically stop excessive sweating today.